Hello and welcome to Medical Dialogues. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Study findings show that receptor location is very important for psychedelic drug effects. Location is the key for psychedelic drugs that could treat mental illness by rapidly rebuilding connections between nerve cells. They show that engaging serotonin 2A receptors inside neurons promotes growth of new connections, but engaging the same receptor on the surface of nerve cells does not. Drugs such as LSD, MDMA, and psilocybin show great promise for treating a wide range of mental disorders that are characterized by a loss of neural connections. In lab studies, a single dose of these drugs can cause rapid growth of new dendrites that are branches from nerve cells and formation of new spines on those dendrites. Study authors call this group of drugs psychoplastogens because of their ability to regrow and remodel connections in the brain. Humans need more winter sleep, finds a study. Scientists studying sleep difficulties have now published data in Frontiers in Neuroscience that shows that even in an urban population experiencing disrupted sleep, humans experience longer REM sleep in winter than summer and less deep sleep in autumn. A team of scientists recruited 292 patients that had undergone sleep studies called polysomnographies at the St. Hedwig Hospital. These studies are regularly carried out on patients who experience sleep-related difficulties using a special lab where patients were asked to sleep naturally without an alarm clock, and the quality and type of sleep can be monitored as well as the length of the sleep. Although the sleep disorders could potentially affect the results, this makes for a large study group evenly spread throughout the year, allowing for the investigation of month-to-month differences. NIH study found toxic protein linked to muscular dystrophy and arhinia. Researchers at the National Institutes of Health and colleagues have found that a toxic protein made by the body called DUX4 may be the cause of two very different rare genetic disorders. For patients who have facioscapulohumeral muscular dystrophy or FSHD or a rare facial malformation called arhinia, this research discovery may eventually lead to therapies that can help people with these rare diseases. FSHD type 2 is an inherited form of muscular dystrophy that causes progressive muscle weakness. Arhinia is an extremely rare yet severe disorder that prevents the development of an external nose and the olfactory bulbs and tracts. Both diseases are caused by mutations in the SMCHD1 gene. In patients with FSHD2, there is overproduction of DUX4, which kills the muscle cells, and this leads to the progressive weakening of the muscles. Post-surgery immunotherapy provides significant, durable benefits for high-risk bladder patients, finds study. Immunotherapy after surgery increased bladder cancer patients' chance of staying cancer-free compared to patients who received a placebo, according to clinical trial results shared in a late-breaking oral presentation at the ASCO 2023 Genitourinary Cancer Symposium in February. The research team presented 3-year follow-up results from the Phase 3 Checkmate 274 trial. Patients on the trial had urothelial cancer of the bladder or upper urinary tract and had tumor features indicating a high risk for recurrence. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.